Looking for adaptive equipment to support bowel management after a spinal cord injury? Whether you're an OT building your clinical skills or someone exploring solutions for your clients, you're in the right place. In this video, I'll walk you through some of the most common challenges experienced during bowel care and adaptive equipment that can support success, tailored to functional ability and spinal cord injury level. Let's get into it. Welcome back to video 8 in the series where we explore the role of OT in BBM. I'm Julia, and today we're focusing on adaptive equipment, how to match the right tools to the right clients to overcome barriers to bowel management success. If you watched the last video where we covered OT-specific assessment and interventions to address neurogenic bowel, you're already one step ahead. But if not, no worries. This video still stands on its own. Before we dive into the equipment, let's do a quick refresher on how we categorize SCI levels based on function. Since hand function and core control heavily influence what tools a client can safely and effectively use. These groupings will come in handy as we review AE later in the video. In C1 to C5 injuries, typically we see absent hand function, max to full assist in bowel management routines. But that doesn't mean they can't participate. Our role is to find ways to support dignity, comfort, and communication during their bowel management care. In the C6 to C8 range, clients often have limited hand function with the introduction of wrist extension. With the right setup, adaptive equipment, and training, many can work towards partial or full independence in their bowel management. And finally, clients with injuries at T1 and below typically have full hand function. While they may still encounter body positioning or routine challenges, they're often able to perform bowel care independently with or without adaptive equipment. Now, let's talk about what's getting in the way. We have anxiety around performing the bowel program, limited understanding of bowel reflexes or stimulation techniques, trunk or upper extremity limitations that impact upright sitting or toilet transfers, side-lying positioning, inserting enemas or suppositories, lower body clothing management or lower extremity positioning, lower extremity spasticity interfering with setup, and poor visualization due to lighting. Our job as OTs help reduce these barriers through education, positioning, training, and of course, the right adaptive equipment. So let's get into AE by functional category and talk about which groups would benefit from these the most, starting with positioning and access aids. These tools help with stability, access, and safety, especially for clients with impaired core strength and mobility. Some examples include a padded 3-in-1 commode, raised padded toilet seats with side cutouts, and bed rails and transfer boards. These are most helpful for the first two groups, the C1 to C5 group, as well as the C6 to C8 group, as it supports mobility and trunk support. Next, we have bowel insertion tools. Inserting suppositories or performing digital stimulation requires motor control and reach. These tools help bridge that gap. Some examples include suppository inserters, dill sticks to support digital stimulation, or the Paracene Plus or similar product, which are both enema systems. These tools are great for C6 to C8, working towards increased to full independence in toileting, and definitely T1 and below for full independence. Next up, gripping and dexterity aids. These improve a client's ability to manage small tools and clothing. Here, we've got universal cuffs to hold stimulation tools, hygiene aids, or mirrors, built-up handles or angled tools to reduce fine motor demands, adaptive clothing to include vertical side zippers or rear access designs, and zipper loops or Velcro closures to help independence with dressing. These are helpful for clients in the C6 to C8 range or T1 and below with fatigue or coordination limits. Next, visual aids. These can be especially helpful for clients with impaired sensation or working from sideline positions. Examples here include LED lit mirrors or hands-free mirrors, allowing visual feedback without compromising position. These tools can help across all categories. On to hygiene aids. These help prevent infection and reduce caregiver dependence. Some options include long-handled hygiene tools and wipes, bidet attachments, and disposable underpads. These tools, again, are helpful for all injury levels. So, how does this all tie back to occupational therapy? Well, AE is just one tool in the toolbox. Our role as OTs is to take a step back and look at the big picture. What functional challenges is the client experiencing? What are their goals, both short and long term? And what strategies or tools can help them engage more confidently and more independently in their toileting tasks. Bowel routines can feel overwhelming, especially at the beginning of their rehab journey. But through thoughtful assessment, targeted interventions, and the right adaptive equipment, they can feel more empowered. Thanks so much for joining me through this walkthrough of AE for bowel management. Be sure to tune in for the final video in the series, where we will pull everything together by highlighting best practices for both bowel and bladder management and strategies to support carryover and continuity long after discharge. Whether you're working in inpatient rehab, outpatient, or home health, you won't want to miss this. See you next time.